Okay, welcome everybody for Clinical Concepts 1. This is considered Clinical Concepts 1 because the second version, Concepts 2, will be on Thursday, which is the optional time. I know we had about 3 people last time, but I think there's a lot of conflicts and that sort of thing. So if you can make it on Thursday at 5 o'clock, we'll do Clinical Concepts 2, which is a little bit more advanced version of what we're going to go through today. So what I wanted to talk about today as far as clinical concepts is that method, that way of having you guys change or transform or grow outside of your normal comfort zone, which is where you are right now, which is being dental assistants and I believe a hygienist. Yes. To more thinking along the lines of a clinician. And by clinician, I'm thinking of somebody who can look at somebody, assess certain points of data, draw a conclusion, and then have some sort of a plan to treat or to evaluate further or so forth. Okay? So in this first clinical concepts, we're going to talk about these here. Blood pressure, heart rate, oxygen, carbon dioxide. I'm going to talk about what this relates in terms of stable versus unstable, and then a little bit about the differences between ischemia and infarction. All right? So, with your preparatory work, we talked a little bit about vital signs overall. Now, who can tell me what the normal range is for an adult for blood pressure? Like, give me a range of normal. Who can give me an answer to that one? 120 over 80. 120 over 80 is, yes, it's a normal value. But when we talk about ranges, we want to talk about systolic and then the diastolic blood pressure. Systolic means when the heart squeezes, and diastole is when the heart relaxes. We talked a little bit about that when we went over anatomy. So systolic blood pressure is that pressure when the heart squeezes and pushes the blood out through the aorta into the arteries. And so that pressure of that bolus of blood that's being sent out is the systolic blood pressure, the number on the top. The minimum value of a normal blood pressure is 90. And then what's the maximum of a normal blood pressure for systolic?
139.
139, yeah, very good. Over, and then for diastolic, what's the low end of normal?
50.
That's 60. And then you can say 89. Or if you don't like to have the 9s in there, you can always say just 140 and 90, right? So a blood pressure of 140 over 90 is high blood pressure, right? And what's the clinical term for high blood pressure?
Hypertension.
Hypertension. For ACLS, we don't mind too much about hypertension. It's a little bit important for stroke because it's one of the predisposing factors for having a stroke. But for the most of ACLS is about cardiac, not necessarily about stroke, a little bit about stroke. So just important for you to know for the ranges. So 140 over 90 is, above that is hypertension or high blood pressure. On the other end, 90 over 60, the clinical term for low blood pressure is hypotension. We talk about hypo is low, hyper is high, tension is pressure, right? High pressure, low pressure. This is the more important one for ACLS, is hypotension, because if the heart isn't functioning properly, it's not going to have enough blood pressure through the arteries. And why is that important? Well, it's because the blood pressure that courses through your arteries is meant to provide oxygen and other nutrients to the critical organs, which is the brain, the kidneys, the heart itself. So if you don't have enough blood pressure, enough coursing through your arteries to support life, essentially, that's when you start to get sick. That's when you start to become what we call unstable. Now, just because you have low blood pressure doesn't necessarily mean that you're unstable. It's just something that's going to lead to instability. When we talk about a lot of the symptoms that people have when they're having a heart attack or other things, a lot of it ultimately is because there's not enough blood pressure bringing oxygen to the vital organs. So hypertension, hypotension, it's important to know basically these numbers right here, 90/60. Sometimes in scenarios or whatever, what they'll do is they'll say something like, the blood pressure is 80/palp. Has anybody heard that term before or know what that means? What that basically means is the blood pressure is so low that they can't read the diastolic blood pressure on the monitor or on the cuff. So the blood pressure is so low that maybe you can palpate a pulse, but you can't read the blood pressure value, the diastolic pressure, because it's so low. Maybe they'll say it's like 60, maybe not 80, but 60/palp. That's the term. Or sometimes what they'll do, they'll just say the systolic pressure is less than 90, and not worry so much about diastolic. You'll see that in some of the ACLS algorithms when they'll say, well, the systolic is less than 90. Well, okay, so they have hypotension. That's one of the signs of instability. Briefly, the difference between signs and symptoms. Can anybody tell me the difference between a sign and a symptom? What's the difference between a sign and a symptom? Anybody else? A sign is something that you can measure, that you can look at, and that you can see. It's something that's observable. A symptom is something that the person is going to tell you how they feel. So a sign would be the blood pressure reading, the heart rate reading, the pulse ox reading. The symptom would be, I feel nauseated. I feel like my chest hurts. That's the difference between a sign and a symptom. So sometimes I'll be a little bit specific about that sign or a symptom. Okay. Anybody have any questions about blood pressure? This is not the best board to erase, but that's okay. All right. Heart rate. So the adult human heart can beat at a certain rate per minute is the standard way of measuring it. So about the lowest you might be able to see it is about 30, and usually about the highest you might see it is about 220. Okay, but somewhere in the middle there is a normal range, and the normal range is one of those things that could be variable depending on what you're doing. Okay, so in your normal day-to-day clinic operations, you might say that the heart rate normally is somewhere between 60 to 100. Something like that, right? Well, when we talk about ACLS, we're talking about people who are going to be sick. Somebody who has a problem with their heart, and so we have a little bit more extreme ranges for this. Can anybody remember what for slow heart rate, ACLS doesn't use 60, ACLS uses a different number for a slow heart rate. Anybody remember what that heart rate number is?
50.
50. So we'll say less than 50. And there's a certain medical term for a low heart rate. Does anybody remember what that is?
Bradyarrhythmia.
Bradycardia.
The key term there is Brady, right? So bradycardia means slow heart rate. And then ACLS will also use the term bradyarrhythmia, especially on the algorithm sheets. Bradyarrhythmia. So arrhythmia means an abnormal rhythm of the heart, and what they do is they primarily define that by a heart rate of less than 50, with some other conditions as well. But bradycardia or bradyarrhythmia, people find it easier to say bradycardia, and it's assumed that they also mean bradyarrhythmia for most cases. So in this class, when you hear me say bradycardia, I also mean bradyarrhythmia, because for ACLS purposes, we're defining that as a heart rate of less than 50 beats per minute. Okay? On the other hand, a fast heart rate, for ACLS purposes, can anybody know what the high end is for a heart rate for ACLS purposes?
150.
than 150. Okay, and so what's the medical term for that? Tachy. Tachycardia or tachyarrhythmia. So somebody might have a heart rate of 120 beats per minute. You might see them in clinic or something. So technically, yes, that's tachycardia. But for ACLS purposes, what we're going to concern ourselves are those heart rates that are greater than 150. Now, if somebody's heart rate is 145, it's not like, well, that doesn't matter. It's less than 150. Well, again, with clinical concept, clinical skills, you allow yourself a little bit of fudging with the definition. So if somebody's heart is 145, but they have the characteristic readings on the EKG monitor or the characteristic symptoms, it's a tachyarrhythmia or a tachycardia. Okay? So for ACLS purposes, our ranges are less than 50 or greater than 150. And that's to help you as you're going through the algorithms and the cards, figuring out where you are when somebody's presenting with a certain problem. Any questions about that?